I'm a nurse and been in healthcare for a long time. I'm currently a palliative care liaison, but I did ER trauma for a long time too. And been asked to talk about after a patient dies. It's often difficult, especially if you know that patient well, um, and you've seen the family, and perhaps their grief has been emotive or demonstrative, or you've just been in that space with them for a long time. And it could be someone you don't even know or just met. But it's when we deal with death in healthcare, it sometimes sticks to our bones a little bit. And it's important to acknowledge that it can be difficult or not. But death is the last rite of passage that our patient will ever go through. So I think it's really important to kind of mark that, identify that, and also just check in with ourselves. How am I feeling? You know, was that difficult? Or am I numb and I'm not feeling anything at all? And there's no right or wrong answer with that, but just that check in, just to see where you're at. You know, as we move through the process of preparing this patient to go to the morgue, as we move through the process of moving through our day, we sometimes just have to take a moment and stop and take a breath. And if you have a religious affiliation, you could say a prayer in your head. You can do any sort of ritual that helps close this book and this page. And sometimes these pages don't close all the way, and that's okay too. And in those instances, if it was someone very close, you can revisit this later on. Grief is not something, it's not a one and done. It will be there for a while. And at least I find that over time, revisiting that process and that person and that situation weeks, months, years from now helps, because my relationship with that grief, it's different than where you are right now, which is the immediate moment after someone has passed away or died. What's also really important to know is that you have family, your coworkers, even if you don't know them well, they were there with you. And so they had that same shared experience. So I think grief always needs a group to help support. So reach out to your friends, reach out to your coworkers, maybe take some moments to talk about it if they're willing or interested. But again, it's always an invitation and an ask. And I want to thank you on behalf of this patient's family. Maybe they didn't have any family there at all, but you know, everyone is loved. Everyone has people that have loved them, and they appreciate the care that you provided for them. And often we may think this is a loss, failure of the system. Well, I've worked long enough to know that sometimes it just happens, and that's the way it is. It's their time, but it's okay to process this. We often need to give ourselves permission for this. So again, thank you very much on behalf of not only the patient, but your coworkers and whoever loved that patient before they died.